So hello and welcome you all to sailtomdsacademy Dental Academy. I am Dr. Malay Trivedi, Director of the Academy and Professor in College of Dental Sciences. So now dear students, we are going to start few videos for the MCQ discussion and concept learning. We are not going to bombard with many MCQs. We are going to explain those MCQs in which you can make mistake. Mainly MCQ for your NEET MDS, INICET and Govt.Denta Exam. So you can see on the screen some cases will be provided, some important points will be provided. So you cannot learn just 1 or 2 points from the MCQ, but a comprehensive learning will be there from the MCQ. So let's start with the current video. So you can see on the screen, you can pause the video and you can read full question. But let's say how to deal with such question. Now you can see the important points I have underlined and highlighted. A 36-year-old man is there having a history of intermittent dental pain, mainly on cold beverages. He has a dental history of previous carious lesion and restoration. The pain tooth was upper right first premolar. There was a class 2 cavity on distal aspect of tooth. And oral hygiene was poor and there was mild gingivitis. If you go for the IUPA, you can see the lesion was affecting enamel and dentine clearly and the radiolucency was very close to the pulp. Okay. And when there has been done a test, there is a cold test by using a tetrafluoroethane, which type of nerve fiber is based stimulated. So that's a question from the current case history. Just I am going to say what will be the diagnosis. It will be a symptomatic reversible pulpitis. Okay, so here the correct answer will be the A, delta fibers. So mostly why we go for the cold test? Because it is the most reliable than the other thermal test. How to do cold test? You have to apply the cotton pellet less than 15 seconds. If you get a positive response similar to contralateral control tooth, it's a healthy pulp. If there is a short sharp pain that disappears rapidly once you remove the stimulus, it is a reversible pulpitis, and if the pain lingers, it is an irreversible pulpitis. And there is no response to this test, the tooth is non-vital. So you can understand from this question, dear student, what was the diagnosis, what type of test was employed for the current problem, and which type of nerve fibers will get stimulated by the cold test. Now let's go for another restorative question. A 32-year-old man was there having amelogenesis imperfecta. You know, it's an enamel defect. There will be a thin enamel. If enamel is thin, automatically the teeth will be hypersensitive. There is one more issue that the patient has a problem of recurrent caries. So full mouth rehab is planned for the functional and aesthetic need of the patient. So what kind of processes will be most appropriate? It will be a PFM of spathic porcelain or a monolithic zirconia, or we can say it's a veneered zirconia. So the correct answer here will be the monolithic zirconia. We are going to see why. Why is it? Because a monolithic zirconia don't have any kind of the veneering. So the chance of chipping of ceramic will not be there. Zirconia can effectively mask the stained teeth. And also when you want to fabricate zirconia, you can fabricate very thin like 0.5 to 1 mm and still they can bear a proper mastificatory force. So we can say, dear aspirant, in this case, as the amelogenesis imperfecta is there, so the enamel will be very minimal and also the interocclusal clearance will be minimal and teeth will be hypersensitive. So monolithic zirconia will serve the purpose. You cannot go for PFM because it requires more interocclusal space to accommodate both metal and ceramic, and same is the case with veneered zirconia. And even feldspathic porcelain is primarily indicated as veneering. So dear aspirant, here the correct answer is monolithic zirconia. So you understand how the diagnosis help in treatment planning for the crowns. So that was all from my side. If anybody wish to join for the NEET MDS INICET government exam, the detail is there on the screen. Okay dear students, so stay positive, work hard. See you shortly with the second video and more such brainstorming MCQs for your NEET MDS, INICET and Govt.Dental Exam. Any help, any doubt, you can DM me.